moms have ended up on the hospital and ventilators and the intensive care units. There's more mortality. You have a lot of the neonatologists at where I work have mentioned to me, like every time you have a spike in COVID, following that, they'll have a lot of moms come in with stillbirths. And it's a lot of the time probably due to COVID and its effects on the fetus, which is like, it's sad because these aren't like necessarily in the first trimester. These could be late in pregnancy, and it's just so traumatizing.
And so preventable, huh?
It's largely preventable, yeah. So we give the COVID vaccine so that mom won't get so sick, and to prevent baby, because baby can first get the COVID shot about 6 months of life.
Welcome back. I'm Dr. Angel here with my fully vaccinated, creatine pumping, table tennis extraordinaire brother, Raman, and today we have a very special guest joining us, Dr. Samantha Johnston. Samantha is a board-certified pediatric infectious disease specialist and someone I've known for a very long time. Today we're talking about vaccines during pregnancy, which ones, why, and whether they're actually safe for the mom and the baby. Samantha's the perfect person for this topic. She's an infectious disease specialist. She studied biology at Stanford. She went to medical school at Columbia. She got a master's in public health. She did her residency and fellowship at UCLA, which is where our paths crossed. And now she's working at Stanford and she works in public health. Okay, Samantha, it's so good to see you.
It's so good to see you guys. It's been a long time.
It has been a long time.
Yeah, thank you for making the time for us today. We're so excited to have you on. For our audience, can we just give them a little bit of background about how we know each other?
So we met like 24 years ago.
That's so long. Yeah. We started residency together and we lived like a couple blocks from each other in Santa Monica. We were doing our residency at UCLA. We actually had overlapped at Stanford too, but we didn't know that. We didn't know each other at the time. And then I think we really got to be friends when I think we hosted a pub crawl together. No, it was a progressive party. We hosted a progressive together, and we started.
What is a progressive party? Oh, where you go from one place to another.
Yeah, you go from like one house to another. Or
is that what medical students call a pub crawl? They call it a progressive.
Except we didn't do it at a pub. We did it from like apartment to
people's
apartment.
Houses. Yeah, not houses, apartments. Yeah.
Yeah, so that's where I think I got to really, then I was like, oh, I guess she and I can be friends. And then, and then I last saw you for your big 50th birthday bash last year.
Yeah.
Why are you aging her? Samantha, you look like you're 28.
Thank you, Raman. I appreciate that. You both look, not a day over 25 or something.
Perfect. Thank you. Which is how old I was when we first met, I think.
Yes.
All right, Samantha. So let's get into the meat and bones of what we're talking about today. I can't believe I'm saying this, but, we got to get serious. I'm about to have a baby, and Ashley had to get a bunch of vaccines during her pregnancy, and I had to get a vaccine as well. If you can talk a little bit about that and maybe help demystify any hesitancies new parents or myself may have when it comes to being a new parent and vaccinations, and just take it away because there's a lot of fluff on the internet. Stick with us until the end of the episode and we'll cover everything you need to know about vaccinations during pregnancy, and maybe everything you never wanted to know about herpetic lesions and genital warts.
Yeah, I think it's really hard for people to know like what to believe, what everybody's trying to do their best to take care of themselves, to take care of their baby. And it's just not clear always from all the stuff that we get from social media, like what's true and what's actually safe and the best thing. So right now in the sort of traditional medical establishment, we do believe that certain vaccines during pregnancy are safe and effective to protect the mom as well as the baby. And those are the Tdap vaccine. So that's the tetanus, diphtheria, pertussis. And really we're worried about the pertussis component of that vaccine. The RSV vaccine that you can give to mom, the flu vaccine, and the COVID vaccine.
Oh, sorry. I'm going to interrupt you. When you said the pertussis part is what we're worried about, we're not worried that it's bad.
About it.
We're worried about the baby getting pertussis,
yeah.
Which is why we want to make sure the mom gets the pertussis
Absolutely,
vaccine.
Yeah. So pertussis can can cause serious disease in young babies when they're too young to receive the vaccine themselves. So when we give it to mom, she makes the antibodies, she passes them along to baby before the baby's born, and those antibodies protect the baby in the first months of life.
Which is really important because the baby can't actually get its own vaccines until starting closer to 2 months. So getting the protection from mom transplacentally is really
And the
important. And I
dad
mean,
needs to
exactly.
get
And the
Tdap as
dad's
well,
right.
right?
So the baby's going to be born into this family, and the baby is going to have mom, dad, grandparents, aunts, uncles, like people around the baby. So you want to make sure that they're as protected as possible. So I had like the grandparents, the aunts and uncles. I was like, if anybody wants to be meeting the baby when she's 2, 3, 4 weeks old, you got to have your Tdap. Not everybody is as militant as I am.
I walked into Walgreens to get my Tdap because I hadn't had it for 7 years. And I think my sister told me I should go get it again because it's going to be a small baby coming in. And, the pharmacist was like, oh, it looks like you got it 7 years ago. She's like, I'm not going to give it to you. And I was like,
Oh,
I need to have it. I'm not going to be able to hang out with my kid unless I get it, per the mom and my sister. And she's like, no, it's been, it has to be every 10 years, even if you're an expectant father. And so then I said, oh, I messed up on the day. It actually has been exactly 10 years. And then she was like, oh, really? And I was like, yeah. And then she gave it to me. It seemed like a hurdle that shouldn't exist. Maybe you can talk a little bit about that while we're talking about Tdap.
I mean, I think the real bang for your buck with the Tdap is the antibodies that mom makes and gives to baby. So when you get your shot, you're not going to give those antibodies to the baby to protect it. But you will, have a lower risk of getting pertussis and passing the illness to the baby. So that's important also. But what really is protecting the baby is those antibodies, so that if they get exposed to the disease, they're not going to get sick.
Yeah, I wonder when it comes to getting a shot when it's not when it's not the actual time to get the shot. And I think this is a bigger question of why vaccine guidelines are so important. I think it comes down to the concern that the insurance company is going to pay for it or not. And I wonder if this person has been told by her supervisor, you have to give the shots when they're due, because otherwise, like CVS or whatever the pharmacy is, doesn't get paid as much or, properly. So,
and dispensing pharmacies have a different, it's different than if you got it at the doctor's office, where the physician has more discrepancy to order things off label than a pharmacist does.
Where the physician has more discretion. Oh,
yeah.
And just to be clear for everyone out there, my 7-year timeline of not getting it is not good enough, right?
What do you mean not good enough?
Well, I'm not covered enough. Like my immunity isn't good enough for a small child.
Yeah. So of that vaccine, triplet or whatever, pertussis immunity wanes pretty quickly. The immunity that the vaccine, confers to pertussis wanes pretty quickly, a certain percentage every year. So if you're already 7 years out from your Tdap, the pertussis component is already probably worn off a good amount. So you'd still be pretty susceptible to potentially getting infected. Whereas the tetanus and the diphtheria parts last longer, and that's hence the 10 years.
Got it. So lying to my pharmacist was a good idea.
And I think from a safety perspective, and nothing's good. Like from a safety perspective, there's no issue with that, as you probably had the vaccine and nothing happened and you're fine. Yeah.
Right. And just to say on that front about the safety of getting repeated diphtheria, tetanus, pertussis vaccines, moms are supposed to get it with every pregnancy. So if you're having a baby when you're 34 or 36, 39, like I did, I was getting my Tdap at every pregnancy, and it was safe. And that was the best way for me to pass those antibodies on to my babies.
Exactly.
But I think that does kind of bring up for grandparents. I looked into this a little bit because I was curious whether, since the immunity for pertussis wanes, should grandparents be getting a pertussis like every 2 years if they're having a grandkid? Baby? Yeah.
I mean, it's not necessarily recommended, and I don't think it's been studied because, like I said, like the antibody to the baby is what's really key. And that's what's going to protect that baby in that pregnancy.
Basically, what you're saying is that the importance of the grandparents or the rest of the family members having pertussis immunity is just not important enough to recommend them getting that vaccine all the time, because it's really just the mom's vaccine that's the most important. And so I think people tried to model it out, and it just didn't make sense for everyone to get a vaccine like with every pregnancy.
Yeah. Yeah. Because when the CDC and ACIP make the recommendations for the population, they take into account the whole cost benefit analysis and all that. And I think bang for the buck is the mom. But I do think it makes sense, if you're worried about it to, you can suggest it to your family, but it's not a formal recommendation.
And how
for
about
them.
friends who just casually come over and hang out? Do they need to have Tdap?
I mean, it's not formally recommended, but I always, if somebody's got a runny nose, don't come over and visit till the baby's had, at least a couple rounds of vaccines. Of course, it becomes a problem if this kid is not the first and there's other babies at home and other kids at home and they're sick all the time. Your enforcement of these kinds of things is impossible. But yeah.
I mean, when my kids were little, with my first, I was almost like a little bit more casual because none of my friends had kids yet. And so it was easier to control the snotty notices. Now we're not talking just about pertussis. We're just talking about just any vaccine or any virus that your kid can get, because toddlers I think I read once that kids under 5 are shedding one virus or another 50% of the time. So that means they're
that
basically...
even sounds like an underestimate.
Yeah, right. They're basically always contagious. So when I had my first, and I was like, okay, I was pretty laissez-faire. But then by the time I had my second, I was like, I already have one snotty-nosed kid today who's vomiting tomorrow. I was like, I can't have other people's babies and toddlers also around. So then I just put the smack down. I was like, nobody coming over now until this kid is fully, I think I waited till 3 months because it was too stressful for me at that stage in my life.
Yeah.
But people do different things. And I used to always tell parents, hey, if you're not comfortable having snotty noses coming over to your house, you can blame it on me. Just say it's just not better. This is a whole other conversation and discussion about what happens. And maybe we should talk about this more when we get to when we have you back for an episode where we talk about the importance of early childhood vaccines in babies, because that's really where when babies get fevers and babies get sick, why it's important for them to be vaccinated. So we'll circle back to this topic more.
Along with that Tdap, so we talk about antibodies against pertussis passing from mom to baby. That's true also for the RSV, which is a new vaccine that got approved and recommended in 2023.
Yeah, so tell us about the RSV vaccine. It's different from other vaccines.
Okay, so about 3 years ago, a couple of new RSV prevention products came on the market, and these the vaccine it's a traditional vaccine. It stimulates the immune system. It's given to mom in the 3rd trimester. She makes the antibodies and passes them to the baby. And it's been something like 80 to 90% effective in preventing hospitalization due to RSV among babies under 6 months old. So it's really been a game changer for babies because RSV causes so much disease in young babies. And the other, so if let's say you miss the opportunity for mom or whatever happens, there's a different kind of in vaccination that we can give to babies as soon as they're born. And it should be given in the first week of life. And this is it's a monoclonal antibody. So basically, it's a dose of the antibody rather than stimulating the baby's immune system to create antibody. It is a dose of the antibody and it starts working immediately. So it works differently from our traditional vaccines. But it's a dose of antibody. It lasts about 6 months, maybe up to 9 months. And it prevents the baby. It's similarly effective to mom getting the vaccine, about 80 to 90% reduction in hospitalizations in babies.
Should it be given on day 1, even if we're not in RSV season?
So no, we give it during the winter. The RSV is typically most active December, January, February, and we give it during that season. So both the maternal vaccine and the monoclonal antibody to newborns are given starting. I think the maternal is given September through the end of January, and the babies are given October through, now this season's been a little bit later, so we're still.
Why do they do it like that? Why not just get it out of the way and move on?
Well, so it only lasts for a certain amount of time, and the highest risk of babies getting hospitalized for RSV is in the first 6 months of life. So as they're trying to get get the babies protected during RSV season. So like if you give it in June, it's going to start wearing off in December, and that's when your RSV season is starting. So you sort of miss of course, that's also the highest risk of when the baby's going to get hospitalized, but you sort of miss the most effective window of it.
I want to give just a little background about RSV to our audience. So RSV is respiratory syncytial virus. It's one of the most common, if not the commonest, of common cold viruses. And almost every kid has been infected with RSV by the age of 3. For adults and most kids, it's a common cold virus. So it's kind of, most of the irritation it does is in the head and neck area. But for babies and infants, it can get into the chest and lungs. So it's a much bigger problem. And I mean, Samantha, I'm sure you remember cases of RSV in the hospital. We had kids who went apneic, babies who just stopped breathing because of RSV. And it's it can be very severe, significant. A lot of babies on ventilators. So if you can prevent your baby from getting hospitalized, this is big. Can you tell me what the difference between this new monoclonal antibody that we're giving to all babies, what the difference between this and the old Synagis antibodies that we used to give to premature babies who were at risk for RSV? Because premature babies are at a much higher risk, or any babies with congenital cardiac disease or congenital lung diseases, they're going to be, or even neurologic conditions can be at higher risk. So we used to, historically, for I don't know, a couple decades, at least a decade.
Wow. Yeah.
We used to give those babies during RSV season a monthly antibody shot that would, give them the antibodies that would protect them against RSV, and that was called Synagis. And so can you tell me a little the difference between Synagis and this new vaccine?
Yeah, I think that's a good question. I think the big difference is that Synagis, like you said, it had to be given monthly. So babies would have to go into clinic, get an IV placed and get a dose of it, and they'd come back every month to do that to protect them during the season. There's actually 2 now. One is called nirsevimab. The other one is clesrovimab. And it just came out this year. These are an intramuscular shot, 1 dose that lasts the whole season. So it's made the whole sort of like logistics around giving that to all babies much more efficient, and it prevents. The Synagis would have worked on all babies also, but it's just much more complicated to have every child come in every month to get a dose of Synagis. So we're giving it higher risk kids, but these new products make it more possible to give to everybody. And we do also recommend for the second year, it's given to the kids who are at higher risk, who have like congenital heart disease or lung disease or certain other higher risk groups. But for all kids, it's really that change in half-life. So the fact that it lasts for a long time after 1 dose is what's really been a game changer.
Should we move on to the COVID vaccine?
Sure. Yeah. So COVID vaccine is another vaccine that we are the medical community, the American College of Obstetricians and Gynecologists, the American Academy of Pediatrics, American Academy of Family Physicians are all recommending to give COVID vaccine to prevent COVID disease in the mom, as well as COVID disease in the first chunk of life in the babies also. So it's the same kind of thing. You're stimulating mom's immune system. She's passing antibodies to the baby and preventing disease for baby in the first chunk of life. In this case, there is COVID causes much more problematic disease in mom as well, whereas RSV, there's probably it's probably worse for a mom to get it, a pregnant woman to get it, because they're generally immunocompromised. Their immune systems are generally relatively weaker at that part of their lives during pregnancy. But in the case of COVID, and this is true for flu too, moms can have a really bad outcome if they're pregnant. So not only does a COVID vaccine work to prevent illness in the baby in the first few months of life, but it works to prevent disease, like moms from getting hospitalized. Moms have ended up on the hospital and ventilators and the intensive care units. There's more mortality. You have a lot of the neonatologists at where I work have mentioned to me, like every time you have a spike in COVID, following that, they'll have a lot of moms come in with stillbirths. And it's a lot of the time probably due to COVID and its effects on the fetus, which is like, it's sad because these aren't like necessarily in the first trimester. These could be late in pregnancy, and it's just so traumatizing.
And so preventable, huh?
It's largely preventable. Yeah. So we give the COVID vaccine so that mom won't get so sick, and to prevent baby, because baby can first get the COVID shot about 6 months of life. And that's true for flu also. We do recommend flu shots be given to mom to prevent serious flu disease in the moms as well as in the babies.
Yeah, I think that stillbirth is just so scary. Just saying the word is scary for a lot of people. But there was a very large study looking at moms who were given COVID vaccine, or it was a COVID vaccine study, and looked compared to the group that did not receive the COVID vaccine, there was a 15% reduction in stillbirths in the COVID vaccinated group. I think if you just told moms there's a vaccine against stillbirth, they would take it. But if you tell them it's a vaccine against COVID, it's for some reason, like mentally, it's harder for moms to wrap their heads around. So that to me is just, I mean, it's a no-brainer for me.
Yeah, I think so, and I think there's been a lot. A lot of people have gotten worried about the COVID vaccine because it kind of got developed so quickly and everything. But I think it's the vaccine that's gotten the most sort of safety studies. There have been millions of people around the world, billions, but like millions of people have been studied for safety, for effectiveness. This includes pregnant women, this includes children, this includes everybody. I mean, you have like entire countries that have been studied. Like Denmark and Israel have these, population databases of where their healthcare is their the data is all available for study, and it's really been demonstrated to be quite safe.
When you talk about COVID, the mom just has to do like your standard COVID shots and standard
It's your regular, yeah.
boosters.
Mhm.
Because most people have stopped doing those boosters. Are they cool without all those boosters? I mean, we're on shot like 5 or 6 now, or 7. I don't even know. I stopped at like 4.
There are higher risk groups. So as you age, there's a higher risk of having severe outcomes from COVID, including death. And the other kind of high risk groups from getting serious disease from COVID are pregnant women and newborns, like younger than a year old, are the higher risk for hospitalization. A similar risk to hospitalization as the elderly. So really, it's kind of the extremes of age where people's immune systems are either developing when you're a baby or kind of on the downtrend when you're older. And then pregnancy, as well as other people who are immune compromised. So let's say somebody has cancer or they're on immunosuppressive medications or something like that.
And in this case, the baby is fully dependent on mom getting the vaccines because we don't give these vaccines to newborns, right? Or
That's
do we?
correct. We don't give them
Okay.
until babies are 6 months old. That's when it's recommended.
So if mom
Yeah.
screws up, got a 6-month window to be like, oh, shoot.
Hopefully there's not a COVID wave during that 6 months. Yeah. Yeah. Because I mean, I think people think, like you're saying, Raman, is COVID like, who cares? Is it still a thing? I mean, I think with if you're not in one of the higher risk groups, your chances are your risk benefit analysis for yourself is probably you'll get exposed to it. Maybe you'll get a cold. Some people do still run into problems. Long COVID is still an issue. And if you're immunized, that'll help prevent that. But for babies, like we will still see babies unimmunized babies come into the hospital who got COVID and are now having a really serious lung infection from it and need to be in the intensive care unit, need to have IVs, maybe need to be intubated and on a ventilator, which is potentially, vaccine preventable.
Yeah, I'm just thinking, like, if it's been, a year, 18 months since I've gotten it, that makes me a higher risk of transmitting it too, right? Even if I'm not symptomatic. So it probably would be best for me to go get my COVID booster.
Yeah. We've been having summer and winter peaks of COVID activity. So that's what's been going on for the last several years. So it's likely there'll be some, more activity over the summer months this year. So that's when if the baby's going to be really young, then.
Yeah, I would say more so than flu also.
'Cause
And that's
yeah.
usually, even when in my private practice, that's what I used to tell parents about flu and COVID. And I think, flu and COVID are kind of similar in that they're kind of they're going to be yearly vaccines that you're going to need. If you want to protect yourself, you're going to have to get them every year. And they're also similar in that they don't necessarily prevent you from getting disease, but they prevent you from getting severe disease. And I think that is a distinction between some other vaccines that are really good at preventing disease.
More, it's in preventing from getting infection. So vaccines aren't great at preventing infection, but and you're right, like there's gradations of how good they are at preventing disease, and versus severe disease. You're right, but like, because they're not going to prevent you from getting infected, they'll prevent you from getting
Really
sick and really sick and in a hospital.
Yeah.
Yeah.
But they also can, like what Raman is saying, and I think you can tell me if I'm wrong, but they can, if they can help you if you're not going to get as serious of an infection, you might not transmit it as much either. And so I will often tell kids or families with young kids, well, your kid might be fine because they're like 10, 15, but you're going to go visit grandma and grandma might not be fine. So you guys have to decide whether you want to get your yearly flu and COVID boosters. I would if I'm going to spend the holidays with grandma, but that's how parents have to decide about the yearly vaccines, and how parents of young children have to decide too. Like in your case, Raman, yeah, I think if I had a young baby, I continue to get my yearly flu boosters and COVID boosters. So, but especially when I was seeing babies, and that's why it's actually a generally standard recommendation in healthcare facilities for healthcare workers to get their flu shots, because you want to protect all the little babies and the elderly and all the immunocompromised patients you're going to be seeing.
All right. So in a nutshell, pregnant mom should definitely be getting her flu and COVID vaccine while pregnant.
Yeah. They're safe during pregnancy. Yeah.
So the vaccines you're going to get during pregnancy are going to be flu, COVID, Tdap, and RSV.
Yes.
And there have been plenty of studies on all of these. They are safe for the mom. They are safe for the baby. And now we're going to just talk a little bit about some things that you can't get shots for during pregnancy and how to prevent those illnesses and how to make mom healthier and baby healthier. So Raman, you had a question about measles, mumps, rubella, MMR. Can we give a mom MMR while she's pregnant?
Exactly. Yeah, that's my question.
No. So MMR and varicella vaccines are not recommended during pregnancy. And that's because they're live viruses that have been attenuated or made weaker so that they don't cause the full spectrum of disease in people when they're given, but they do cause the immune reaction so that people can fight them off. But what that means, because during pregnancy, that's a relatively immunocompromised state. So mom's immune system is weaker. There could be side effects from that virus replicating in a person whose immune system isn't fully competent. So we do not give it during pregnancy, MMR or varicella.
Samantha, could you kind of explain what MMR and varicella is? Because like what MMR actually stands for? Because I don't think anyone has ever said, hey, I'm coming down with a case of varicella.
Maybe you haven't. Okay, so yeah, sure, of course. So MMR vaccine stands for measles, mumps, and rubella. Measles is a viral illness that generally causes a fever and a rash, and people feel just like really miserable. And I think what sometimes people don't recognize is that it can definitely lead to mortality. A couple of people per 1,000 who get measles will die. And that's usually because of a pneumonia. So it affects the lungs, and it can cause pneumonia. It can affect your immune system. It does a whole lot of things.
And that's in developed countries like the US, like 1 to 3 per 1,000 are going to die, like you said. And then globally, I mean, there's
probably higher because of like malnutrition and things like that. That might
there
affect.
are still over 100,000, some estimates like 250,000 deaths a year worldwide attributed to measles, if I recall correctly.
Yeah. And it's a vaccine preventable illness. Yeah. The second M is mumps. So that's kind of classically an illness. It also causes like fever and some runny nose stuff, but it causes like chipmunk cheeks, like swollen parotid glands, which are the salivary glands in your cheeks. And that one it can also actually, people think, oh, whatever, it's just the mumps, but it can also cause, especially in older boys, swelling of the testes, which I don't think generally boys want. And it probably might affect fertility to a certain degree in post-pubertal men. Probably also causes inflammation of the ovaries in women when they're older, and low percent, but some people also can get a brain infection due to mumps. So that's the other M. And then the R is rubella. So rubella is kind of the biggest one as it concerns congenital infection. So with a congenital infection being the mom gets infected and then passes that along to baby. So if a mom gets rubella and gives it to the baby, that used to be a really common cause of babies having developmental problems, problems with brain development, hearing loss, and like cataracts, blindness. So that was a really common cause until universally everybody was immunized against rubella with the MMR vaccine, and that really decreased the rates of congenital rubella syndrome. So that's been huge.
And so is MMR one and done in a lifetime?
No.
So if you're planning to get pregnant, should you get MMR before you get pregnant? Like, how does that work?
Well, it's a routinely recommended vaccine for kids. So it's recommended between 12 and 15 months and at 4 to 6 years. So it's a 2-dose series. So that protects you. Well, measles and rubella, that protects you pretty much lifelong. Mumps, immunity wanes usually. So we'll see outbreaks, 10, 20 years after people have gotten vaccinated. But the measles and rubella part are pretty much lifelong immunity after that 2-dose series.
You do get tested during pregnancy.
Yes.
Moms are tested to see if they are rubella immune during pregnancy. However, if you are rubella non-immune during pregnancy, there's nothing you can do about it. Because you can't get the live vaccine while you're pregnant. So what they do before you leave the hospital, we do recommend that you get your MMR vaccine before you leave, so that for your next pregnancy, you will be rubella immune. Or if you ever get pregnant again, you'll be rubella immune.
Yeah, exactly.
On
and
the varicella?
That's chickenpox.
Okay.
Yeah. So
that I've heard of.
So yes. See, I had chickenpox when I was little. The disease. You guys, I assume, did too.
Yeah. Did you call it varicella back then, Samantha?
Of course. Yeah, Come on. I always knew I was going to be an infectious disease doc when I was 5.
I wouldn't be surprised.
No. Yeah. That one became recommended in the 90s in the United States. And I think also people you think of chickenpox and they think, oh, not a big deal. Like I had it when I was a kid. It was fine. But there's also, especially when people get it older, people can get pneumonia due to chickenpox. A lot of people would also end up with really bad bacterial infections around the pox, the little like skin sores, and you could get septic and die from that. So the chickenpox vaccine has actually been really great in preventing those kinds of bad outcomes. But then also think about all the days you missed from school, the days your parents had to take off of work and all that. It's also
and the chickenpox parties.
We have to miss those now.
I hate missing a party. Even if it's a chickenpox party.
So let's not miss though that we don't want moms and kids to get chickenpox, because there's you're missing school and you could get a secondary bacterial infection. You could get a varicella, chickenpox, encephalitis, and if you get vaccinated, your risk of shingles down the road is also lower than if you get the regular infection. But we also have to, just if you could briefly mention about congenital varicella syndrome, because if a mom is not immune and gets chickenpox during pregnancy.
You're right. Yeah. Thanks for mentioning that, Angel. Yeah. If a mom is not immune and gets chickenpox during pregnancy, especially right around the time of birth, babies can, well, that's actually not true, because if the mom gets chickenpox earlier in pregnancy, babies can be born with like scarring and sometimes like finger amputations, like missing different parts of their body because of the scarring from the pox they can get while they're a fetus. And if the baby's born to a mom with chickenpox right around that time of delivery, they can get a really, really, really nasty infection right around the time of birth that can be very severe and definitely life-threatening. So it's one of those kind of things that If I get a call about a mom with chickenpox and a baby was just born, yesterday or is going to be born tomorrow, it's kind of one of those like infectious disease emergencies. Like we need to handle that because that could be really dangerous for the baby more, but also for the mom.
Okay,
And
so
it's treatable.
yeah, okay, that's good. Yeah, because how do you treat it?
So you can give acyclovir is a really good antiviral medication that we can give to treat it, and we can also give IVIG, which is it could be given as a prevention to prevent the disease from taking hold, and that's a big dose of antibodies. And in that big dose of antibody, like I was saying for RSV, it prevents, in this case, a lot of different things. It's kind of a general antibody, but it includes antibodies against chickenpox. Whereas for RSV, that dose we give the babies is purely against RSV.
Like an antibody specifically for RSV versus this. No, that's great. That's a great segue for me to ask you a little bit about a virus that's related to chickenpox, but different, the herpes virus.
Yes.
And so there's no vaccine for herpes virus. And if a mom has a genital herpes outbreak during pregnancy, what are the risks to the baby? And then if you could talk about during pregnancy and around delivery.
Sure, sure. And I want to go back to, because I said we can give IVIG as a preventative for varicella, but there is also a specific varicella immune globulin that sometimes it's hard to get a hold of, but sometimes it's not, but that's also available. So yeah, herpes is another virus that a lot of people think of. You got an ulcer on your lip, or you could get genital ulcers, but it's not that big of a deal. Well, that's not true for newborn babies. If a newborn baby is born to a mom with active herpes, and this is the mom's first outbreak, that baby has about a 50% chance of getting what we call neonatal herpes. And that infection can be on the skin and the eyes and the mucous membranes. And if it's in the eyes, that can cause a problem with vision also. It can be in the bloodstream, and it can affect vital organs, and it can also be in the brain. And that can be really devastating. Babies can have seizures and babies can die, and babies can end up with these seizure disorders for their whole life because of herpes.
So if a mom has herpes, does she proactively take acyclovir or whatever you take?
Yeah, exactly.
While she's pregnant?
Yeah. So especially like in the third trimester, her doc will be doing vaginal exams, and if they see any lesions, they'll put mom on acyclovir, especially leading up to delivery and during delivery to prevent transmission to the baby. And we have a protocol of checking the baby also to see if they've gotten infected as well, and
So
treat if
what
we
if
need
she
to.
has herpes but doesn't show or isn't having an outbreak?
So that can happen. So a lot of people who have been infected with herpes. So herpes is one of the infections like chickenpox that once you get it, it stays with your body. And some people have outbreaks from time to time, and some people don't. But some people shed the virus without having symptoms. So moms can be in that category and have genital herpes and not show any symptoms, and the baby can pick it up. So, and the baby can also get it from other people. So baby can go home. Let's say, grandparents, whoever at home has a lip ulcer. Or let's say they're asymptomatically shedding. And we definitely see babies who we have no idea where they picked it up, but they come in and they have little vesicles. And that is something that we need to look into to make sure it's not herpes, because like I said, it can really be devastating for a baby.
I was just picturing saying like, sorry, you can't come in. There's something on your lip.
No, but we'll have dads being like, oh, I've got an outbreak. I'm going to cover it up. I'm not going to kiss the baby till it goes away.
So you said that doctors do a vaginal exam on the mom to make sure they don't have an outbreak, but do they also need to be doing blood testing? Because if she could be asymptomatic and shedding and not showing.
So I don't think it's routinely one of the screening blood tests that women get in pregnancy, but some people will have their like herpes antibodies checked. Some people know what their history is. They know they've been having outbreaks their whole life, or however many years they've been having them for. But if let's say it's somebody who's had herpes and they know they've had herpes, she has antibody against herpes because she's been exposed to it over time.
Right. The chance of a first outbreak is so low, probably.
But it happens. Yeah. But if the baby's born to a mom who's already had a history of herpes and she's got active lesions, or the baby's born exposed to herpes in that scenario, baby's also getting antibodies from mom to protect them, but they still have a 2 to 3% chance of getting active herpes, neonatal herpes disease. So it's cut down from 50% to like 2%, but it's not nothing.
All right. Well, this conversation has given me a bit of an anxiety attack. So let's move over to our medical breakdown.
Yeah. Okay. I think there are so many points I want to make. First of all, this conversation could have gone on for another few hours because we didn't even cover all the infections that moms can get during pregnancy and all the things that you could pass on to your baby if you get during pregnancy. It's just a lot of work being a pregnant mom. And then you're like, what? I could get a cold and that virus could cause damage to the baby. And yes, that can certainly happen. But there are a few vaccines that we can get that can prevent some of these infections from being passed on to the baby and affecting the mom for that matter. So the pertussis vaccine, the COVID vaccine, flu, and RSV. So if you know or love a woman who's pregnant, or you are a woman who's pregnant, I would talk to your doctor about those vaccines.
Right.
So these vaccines have been studied extensively and have been found to be safe for moms, safe for babies, and effective. Now, there is always a risk-benefit analysis. Samantha, do you want to speak briefly to that?
Yeah, because we've talked about a lot of the benefits of these vaccines, but I do want to just point out that every medication, biological product, vaccine that we give does carry a certain amount of risk. And the vaccines are all studied to make sure that they're safe. But if somebody's, there's a very low percent of the time, like it's something like 1 in a million or less of people who will have an anaphylactic reaction to one of these vaccines. And if you know that that's happened to you in the past, probably not something to repeat. And let's see, for the flu, that's kind of the biggest concern. For the Tdap, that's also the biggest concern. COVID, and I think that the big thing for these is really anaphylaxis concern is probably the biggest thing to be aware of. But sometimes people do have severe vaccine reactions, and the way I think about it is, it's a cost benefit, it's a risk benefit analysis. So, what is my risk of being exposed to this illness? If it's 0, then okay, maybe you don't need that vaccine, but that's not the case. We live in a world that's full of infections. And if you're going to be exposed to something, then you have to think, okay, if I'm exposed to this vaccine, this illness, do I want to be exposed to it with some protection on board, or do I want to be exposed to it without that? And if I have the vaccine on board, that's going to decrease my risk of getting the bad outcomes from the illness, versus if I get the vaccine and have maybe a less than 1 in a million chance of getting anaphylaxis or some other very, very rare reaction. So that's kind of how I like to phrase it, because it's not a 0 risk situation getting a vaccine, but it's very low and it's less risky than getting the diseases just freely.
Yeah. And on that note, I think some people feel like what a hesitation I would hear often is, well, I get the flu when I get the flu vaccine. And you might feel sick, you might feel a little down, but that is your body's immune system being activated. And I think people should know that that's actually a good thing. Like, you want your body to have an immune reaction to the vaccine, because that's the whole point.
Yeah, then it's working. So that when you actually get exposed to the flu, you're not one of the people who ends up in the hospital. Like, you might still get a fever, like we were talking about that earlier. It doesn't necessarily fully prevent infection in all disease, but it keeps you out of the hospital. And that's really, you don't want to be in the hospital. You don't want to die from the flu. It's like, why? Just get your shot and you won't.
Exactly.
All right. Should we move on to, is this normal?
Is this normal? So we talked a little bit about chickenpox and measles, and a lot of early childhood illnesses cause like little bumps, little blisters. And I just wanted to tell parents, just in case your baby is one of the babies that has a newborn rash. Newborn rashes are super common and they're almost always benign. So if your baby comes out and like in the first day of life has little blisters on the face, I don't want you to freak out. these are probably little blisters called neonatal pustular melanosis, and they're just these cute little bubbly blisters, and they pop and they leave a little dark mark, usually sometimes a lighter mark, and then they go away with time. So there are other kinds of rashes that babies get, little red rashes in the first week of life, like red bumpy rashes called erythema toxicum, which is a scary name for a totally benign rash. So when you see your baby, if you're worried about any rashes that your newborn has, talk to your pediatrician. These are usually very common and benign rashes. The nurses in your newborn care nurses are also probably very familiar with them.
But you might want to, if you do see a rash on your baby, mention it to your doctor, because it could be one of these more severe illnesses, such as herpes or that kind of thing.
100%. You don't want to assume it's a benign. So yeah, thank you for saying that. And, everything we're saying here is two doctors and a dude having a discussion about rashes and vaccines, but none of this is medical advice for you. Discuss everything with your own doctor.
All right, let's move on to stuff you didn't know.
Okay, Dr. Johnston, I don't know if you knew this. I only found out recently that measles can cause something called immune memory loss, which means that all the antibodies that your immune system has made to certain diseases and infections, like if you recently got had COVID, you probably aren't going to get COVID again right away, right? Because you have those antibodies. But if you get measles, it kind of destroys that immune memory, and you're susceptible all of a sudden to these diseases that you were immune to. I had no idea. Did you know that?
Yeah. So I think for a long time.
Yeah, I knew it too, Angel.
You knew that?
No,
See,
I did
table
not.
tennis has paid off. I think a long time, decades ago, people noticed that when people got measles, they would get flares of tuberculosis would get worse, and things like that would happen. They would do population studies after the measles vaccines got introduced, and they saw that not only did mortality from measles go down, but so did mortality from all these other infections. So they knew something was going on. But more clearly, Michael Mina's group about 10 or so years ago kind of defined and described this immune amnesia effect, which seems to happen because measles, when it is making its immune memory in your body, it does a really good job. So it kind of co-opts all the cells that make antibodies. It sort of takes them all, either destroys them because of the virus, or it makes them make antibody to measles. So you have great immunity to measles that's lifelong once you get infected, but it destroys
or
a
you
lot
get the
of
vaccine.
those. Or you get the vaccine, yes. But it just not the vaccine virus doesn't do this, but the natural virus does co-opt kind of the immune memory for other things that you've been exposed to. And it's not 100%, and it's not for every, it's probably in varying degrees. I think their group estimated 20 to 70% of immunity gets sort of wiped out, and then you have to rebuild it up again. So you have to get re-exposed to all those things to redevelop that immunity.
Absolutely terrifying. So basically, all other viruses out there are really rooting and cheering for measles, huh?
Yeah, and bacteria, all the stuff that, and it's a major problem post measles, getting all these other infections.
It actually makes me wonder if other viruses do this to a different extent, because you do kind of see, or in practice, just anecdotally, I would see kids that would get sick and that had completely competent immune systems, and then get sick again and again and again. And you kind of wonder what's happening to their immune systems there, why, their immune systems get so knocked down and then takes a while to come back. So I wonder if we'll learn about this immune amnesia in other viruses.
Relatively, yeah. I think especially with flu, people get bacterial infections in their lungs following flu, and then you get again and again and again. Yeah.
Right. Well, because we know that the viruses can cause some immune suppression, and then that makes you susceptible to bacterial infections. But then even after it goes away, if you have
how long does that last?
Susceptibility to other infections, how long does that last, and why exactly is that? That's very interesting to me. Well, wow. I feel like we covered a lot, and we can't wait to have you back, Samantha, Dr. Johnston, who is just a wealth of knowledge. So I want to have you back so that we could talk about early childhood vaccines, and I hope we can do that soon.
Yeah, it's been really fun to see you guys, and I'm excited for the baby, Raman.
Thank you. Everyone's very excited, and I'm getting there.
How do you feel?
Getting there one day at a time.
Yeah, that sounds about
Hey,
right.
by the way, Samantha, I'm going to have to get your phone number. I heard you're accepting 2 a.m. phone calls.
Well, if I should turn my phone off at night, but yeah, definitely, I can be on call for you. I will.
Yeah.
I will.
Love
Any
it.
newborn rashes, just call Samantha.
No. Well,
Yeah.
the regular rash is called Angel.
Sweet. Got you on
I'll
speed
triage.
Your
dial.
sister.
I'll just add you in my phone as Rash
Sweet.
Samantha.
Okay. Oh, great. That's amazing. I would appreciate that.
All right. Well, thanks again, Samantha and Angel. You guys are wonderful.
Vaccines during pregnancy is one of those topics that gets a lot of noise and not enough signal. Today, Dr. Samantha Johnston, my very good friend and very decorated pediatric infectious disease specialist, gave us that signal. If this helped cut through the confusion for you or someone you know who's pregnant right now, please share this episode, rate and review wherever you listen, and we'll see you next time.